am Dr. Meeta Airen. I am a fertility consultant at Zeeva Fertility, Noida. So today we'll discuss what are the major important 3 causes of female factor infertility, because many a times females are not knowing why they are not able to conceive, and by my video some idea can be given to the patients, so that you can just assess what problem you might be having and you can just take a fertility treatment and assess yourself. So, in first of all, 1 in 10 couples, they are affected by infertility globally, and out of all 40% couples, infertile couples, they are having a female fertility issues. So, there are major 3 reasons why females are not able to conceive, which we see in day-to-day routine practice, why females are not able to conceive. So, these are the major reasons. First of all is, first and foremost, it comes to be PCOD. You might be very commonly heard about this disease, that is PCOD, that is polycystic ovarian disease. So, because of nowadays lifestyle issues and many young girls as well as ladies, they are having some menstrual irregularity problems, like they are having delayed periods, and sometimes the females, they don't have periods without taking medicines. This is the classic symptom which females usually have if they are suffering from PCOD. So if you are having this symptom, then you should investigate yourself and just diagnose at least that you are having PCOD. In PCOD, why the female is having difficulty in conception is basic problem is the problem of egg development. In PCOD, the eggs are there, but they are not able to develop timely, and there is a problem in quality of egg development also. So, by certain small treatments like some medications or some few injections, some ultrasounds throughout the menstrual cycle, this problem can be treated. So, in this problem, the major symptom is menstrual irregularity, and the patient is not having periods for a long period of time. Now, the second problem which is commonly seen in females nowadays is low AMH. So, first, what is AMH? AMH is a hormonal test which is done by the blood, and it gives an idea of egg reserve in the female. This is very commonly nowadays seen, and might be because of certain environmental factors that we are seeing many cases of young females having low egg reserve. The reason is at present we are not exactly knowing why this low AMH is there in young couples, but in normal scenario, the egg reserve is usually declining after the age of 35 to 40 years. But recently, in many OPD patients which are coming to fertility clinic, we are seeing low egg reserve in many young couples also, young females like 25, 28 or 30, also the egg reserve is reducing. So, this is the major reason why females are not able to conceive. So, if the symptom, sometimes you might be seeing in these cases like your periods, if you had been having your blood flow during the periods for about 4 to 5 days, now your bleeding has reduced to 1 to 2 days. In this type of change in your menstrual blood flow, you can see if you are having low egg reserve. Sometimes the patients, they are not knowing, and if they are not conceiving, then they visit some fertility centers, and when the tests are done, then they come to know that they are having low egg reserve. So, these patients definitely they require certain treatments. Sometimes they might also require to go to treatments like IVF. Then the third major important reason in females is tubal factor infertility. So in India, there are certain diseases which are very common, and they might affect the tubal factor. So basically, when we think of tubal fertility, that means there are fallopian tubes by the sides of the uterus, which needs to be patent for a patient, for a female to become pregnant. If their patency of the tubes is affected, then the female could not be pregnant by natural means. So there are certain diseases which are very prevalent in India, like tuberculosis, which if a female is having a history of tuberculosis in the past, like in childhood, or if that female's any family member had tuberculosis, then in these patients they might be having some problem in tubal patency, so it has to be tested. Another factor which results in tubal factor infertility is sometimes females, they have some vaginal discharge problem for very long time. So the vaginal infections, they may convert into pelvic infections, and then it may result in tubal factor problems. Also, there is a disease known as endometriosis, in which there are certain cells or some pathologies developed in the pelvic cavity, that means inside the abdominal cavity, and then that adhesions, they results in tubal factor. They cause distortion of the tubal anatomy, and then there might be some problems in the tubal patency. So if the fallopian tubes are blocked, then in those cases females are not able to conceive. If these reasons are there, then there are treatments available, and like in tubal cases, in most of the cases, when the tubal factor is the problem, then we definitely need to move to the IVF, because IVF is the procedure in which the fallopian tubes are bypassed, and then the patient can conceive. So these are the three important factors which needs to be taken care of, and if you are feeling that out of these any of the symptoms you are having, then you should think about it and just investigate yourself, so that you can take a proper treatment and achieve conception. Thank you. If you like this video, then please share and subscribe to the channel. There are other videos also to help out, and if you have any queries regarding this, you can just post in the comment box. We will try to solve it out.